Okay, good afternoon, everybody. Thank you for joining us today on our hashtag Wednesday Weekly, a weekly information session in collaboration with the voluntary sector and public sector partners. So today's session is all about our Quality in Action Award. And our host today is Mohammed from the Rochdale Dawah Centre. So Mohammed, I'll hand over to you. Thank you.
Hi guys, just share my presentation, just give us a second. Can everybody see that clearly and hear me fine, yeah? Okay, cool. All right, yeah, so just firstly, thank you for Action Together for organizing this. I think it'll be really beneficial for the attendees, and obviously thank you for all the attendees for coming and taking some time out your busy schedules. Yeah, so my name is Mohammed from the Rochdale Dawah Centre. We've done the Quality in Action Award last year, and I thought it would be really useful to run this session and kind of like promote it so the organizations can benefit as well. So about the RDC, we established in 2003. We're a faith-based organization. We've been predominantly running faith-based projects, but we do run a lot of non-faith-based projects as well. Most successfully, we've been running our project for the deaf community. So that's been like a support service mainly. That's been running for maybe over 6 to 7 years roughly, and that's been really successful, especially with the deaf community. Oh yeah, I was going to say as well, most of our projects are predominantly aimed at the BME community, and we've got a good set of volunteers. So we've got about 15 to 20 volunteers, and the management team is quite varied. Myself, I'm a I should have said at the start actually, I'm a trustee. I work in the NHS. And the other management team, we've got a teacher, we've got an accountant, and we've got an electrician, and what's the other one? Yeah, so there's 2 teachers, and the volunteers come from all different backgrounds. And I think that's what makes most of our projects quite successful. Over the last few years, I've just recently left a job working in mental health. I was there for a good few years. I'm still in the NHS. And because of that, we've run many mental health projects over the last few years and increased more during the pandemic. And they were quite successful, especially we produced like a well-being pack. I could maybe share that later, or you could go on our website. And that was proved really popular because it's got like guide on what to do to improve your mental health and well-being. Along with that, it's got contact details of support services within the local area. So not just Rochdale, but Greater Manchester. Yeah, so for this session, the Quality in Action, obviously there's more details on what it covers on the Action Together website. But in a nutshell, it's basically, it's like an approval of your governance, and basically you can be used for developing your organization and your team as well. So there's like so many different benefits, and that's what I'm going to go through now in terms of how it benefited us. How we started, basically, I think it was early in like end of 2019 or early 2020. Basically, we did an organization health check by Action Together. So we had like I had a one-to-one meeting with Haley. And basically, she had like a checklist, and it had like different questions on in terms of what you have at the moment. So, for example, if you got like a constitution, if you got which policies you have and you don't have, if you've got like a fire safety checks, if you got any insurance, even if you got like a website logo and things like that. So it was quite varied, and I think that was really useful, and that was kind of like our eye-opener in going into this. So obviously we realized that even though we've been running since 2003, we still had quite a lot to do. We did have we did have quite some of the things on the list, but we needed a lot more. So basically, and that's the reason why we started the Quality in Action Award. And then obviously the pandemic hit, and it was actually a benefit for us because obviously we had most of our team volunteers, like the teachers especially, they were working from home, or when they were on holiday had a lot more time. So especially over the Christmas break, I kind of like the 2 teachers we got on the board, I kind of forced them to kind of give their time for 2 weeks to prepare like all the paperwork that we needed. And so we had a lot of support from Action Together. So it was Sarah and Haley at the time. And there was a lot of one-to-one meetings. So we'd go through like the checklist of what's exactly needed. So we kind of had to and fro's. So and basically a lot of things were going through draft. But in the end, we produced quite a lot of material. We produced about maybe 20 plus policies and procedures, of which maybe we had already about 5 or 6. Not to put you off, but I think the benefit of that was obviously moving forward, having these policies and procedures, not just having like the paperwork. It also kind of gives that kind of guidance to our volunteers and our service users, and also that protection as well, which is quite key. Also from that, we kind of had because I work in NHS, obviously I've done quite a lot of training in safeguarding and fire awareness and information and governance and things like that. So that proved quite vital in terms of helping us to go through this a bit more quicker. But we still trained up some of our key volunteers and management team on safeguarding and information governance and a few of the like health and safety things. But whenever we do any projects, it's myself as the safeguarding lead, I kind of cascade that information to our volunteers. We also produced a full like volunteer policy, which included things what they do, and also like a application form, and like even like a mini kind of like contract what it entails to be a volunteer. So we had that support from Laura in Action Together. That was really useful as well. So that kind of played in to get the quality in action for us. So in terms of why we would recommend the quality in action, I would definitely recommend it because in terms of, like I mentioned previously, the kind of protection and guidance for both our service users and our volunteers. Since we got the quality in action, also we got the public liability insurance to cover for our events and our venue as well, and also we got a full-on fire risk assessment. Along with that, we already had fire extinguishers and like fire exits and things like that, but we just kind of improved on that. These things did cost us quite like a few £100 altogether, but we kind of what we did was we strategically kind of included at the time when we were applying for grants. We kind of within the projects we applied for that, because I think the fire risk assessment, because you obviously you can't do that yourself. With the general risk assessment, we did that ourselves for the venue and for each event and things like that. But for the fire risk assessment, you need an external company, and that needs to be kind of like signed, just like how you get a boiler signed off by a plumber. So we did that as well. But that's been really positive, because obviously, even though we had the basic fire safety requirements, we didn't realize we missed a few things. So that risk assessment was quite good, and it's kind of gives that peace of mind to our service users as well, knowing that we've got that, and that was all to do with quality in action. Otherwise, we probably would have not got that. In terms of, I'm not following the list. I'm just going up and down the list. In terms of the struggles, it was initially a bit daunting looking at that whole list of checklist. I think if I remember correctly, it was about maybe 20 to 25 things on the list, covering all different things. So from your organization governance, safeguarding, health and safety, equality, your finances, and how you document that. So it was like the checklist was separated into about 6 or 7 categories. So obviously initially looking at it, it was daunting, but once we got started and the support we got, it was just kind of just getting the ball rolling, and it was okay. Like I mentioned, because of the pandemic, we were quite lucky in terms of the team. We were able to have a bit more time whilst working from home. We're all volunteer led, so it's a bit much, as you can imagine, it's very challenging to do anything like this when you've got all volunteers, and obviously for myself to kind of manage that. But it was, even though it was difficult, I think in the end it was well worth it, and the hard work paid off. And I think it was really positive, especially because I think we were really happy because we've added it to our website as well. And obviously we were the first organization in Rochdale to achieve it. So that was really, really positive. I think my advice for everyone on the call is just to get started. The support is there from Action Together. I think you just obviously just need that initial step and to move forward, discuss it with your team. Like I did, basically, I got different people in our team, our volunteers, to basically take up different tasks, just to scatter it. But I think moving forward, it's been really positive. Like I mentioned, it's helped us produce a lot of material to give that confidence to our service users. Not only that, since I think we got the certificate last, I think it's been about 6 months. And since we've got that, we've added it to our website. Also, when we are applying for grants now, we make sure we put that in. And I think that's been really positive because obviously that kind of gives us that approval that we've got our documents in place. But we've got we've got our accounts and we've got our policies in place. So when we are submitting grants, is tagged along with that. So yeah, it's been really positive. I think that's about it from my side now, if there's any questions.